The distinguished Speaker of the House is recognized, and the House will be in order.
Thank you, Mr. Speaker. I thank the gentleman for yielding. I thank all of you for bringing us to this moment. It is with great humility and with great pride that we tonight will make history for our country and progress for the American people. Just think, we will be joining those who established Social Security, Medicare, and now tonight, health care for all Americans. In doing so, we will honor the vows of our founders, who in the Declaration of Independence said that we are endowed by our Creator with certain unalienable rights. And among these are life, liberty, and the pursuit of happiness. This legislation will lead to healthier lives, more liberty to pursue hopes and dreams and happiness for the American people. This is an American proposal that honors the traditions of our country. We would not be here tonight for sure without the extraordinary leadership and vision of President Barack Obama. We thank him for his unwavering commitment to health care for all Americans. And this began over a year ago under his leadership in the American Recovery and Reinvestment Act, where we had very significant investments in science, technology, and innovation for health care reform. It continued in the President's budget a few months later, a budget which was a statement of our national values, which allocated resources that were part of our value system, and in a way that stabilized our economy, created jobs, lowered taxes for the middle class, and did so and reduced the deficit, and did so in a way that had pillars of investment, including education and health care reform. Health care reform and education equal opportunity for the American people. And this legislation tonight, if I had one word to describe it, would be opportunity, with its investments in education and health care as a continuation of the President's budget. We all know, and it's been said over and over again, that our economy needs something new, a jolt. And I believe that this legislation will unleash tremendous entrepreneurial power into our economy. Imagine a society and an economy where a person could change jobs without losing health insurance, where they could be self-employed or start a small business. Imagine an economy where people could follow their passions and their talent without having to worry that their children would not have health insurance, that if they had a child with diabetes who was bipolar or pre-existing medical condition in their family, that they would be job locked. Under this bill, their entrepreneurial spirit will be unleashed. We all know that the present health care system and health insurance system in our country is unsustainable. We simply cannot afford it. It doesn't work for enough people in terms of delivery of service, and it is bankrupting the country with the upward spiral of increasing medical cost. The best action that we can take on behalf of America's family budgets and on behalf of the federal budget is to pass health care reform. The best action we can take to strengthen Medicare and improve care and benefits for our seniors is to pass this legislation tonight, pass health care reform. The best action we can do to create jobs and strengthen our economic security is pass health care reform. The best action we can take to keep America competitive, ignite innovation, again, unleash entrepreneurial spirit, is to pass health care reform. Thank you. With this action tonight, with this health care reform, 32 million more Americans will have health care insurance. And those who have insurance now will be spared of being at the mercy of the health insurance industry with their obscene increases in premiums, their rescinding of policies at the time of illness, their cutting off of policies even if you have been fully paying but become sick. The list goes on and on about the health care reforms that are in this legislation. Insure 32 million more people, make it more affordable for the middle class, end insurance company discrimination on pre-existing conditions, improve care and benefits under Medicare, and extending Medicare solvency for almost a decade. Creating a healthier America through prevention, through wellness and innovation, create 4 million jobs in the life of the bill, and on doing all of that by saving the taxpayer $1.3 trillion. Another speaker, Tip O'Neill, once said, "All politics is local." And I say to you tonight that when it comes to health care, for all Americans, all politics is personal. It's personal for the family that wrote to me who had to choose between buying groceries and seeing a doctor. It's personal to the family who was refused coverage because their child had a pre-existing condition. No coverage, the child got worse, sicker. It's personal for women. After we pass this bill, being a woman will no longer be a pre-existing medical condition.